Good afternoon, and thank you for joining us. Today is Tuesday, March 22nd, and on today's briefing, we'll hear from Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Dr. Michael Gutzeit, the Chief Medical Officer with Children's Wisconsin. So thank you both for being here, and I will hand things right over to Dr. Weston to get us started today.
All right, thank you, Catherine. Good afternoon. First, to our numbers, we're seeing in Milwaukee County an average of 38 new cases per day and still 0 deaths per day. We continue to see encouraging decreases in cases and positivity for COVID in our community. Our hospitalizations remain a bit higher than we'd like without as much downward movement. Around 65 people hospitalized with COVID in the county. Now, hopefully these trends will decline as well. And our CDC community level continues to be solidly green. And we did add a new tab on our COVID-19 dashboard showing the trends for each of the 3 metrics that compose our community level. So that's cases per 100,000 population, hospital admissions per 100,000 population, and percent of staffed beds that are COVID positive. Now, this new tab will help us, as well as other decision makers and members of the community, to see specifically how we're trending with respect to those CDC community levels. And we'll be updating it each Friday with the CDC's updates. Now, we talked last week about wastewater surveillance and possible increases that were being seen locally. And as we discussed then, it does seem that this was more a factor of variability among small numbers than a true trend, as that increase has largely dissipated. Now, that said, wastewater will remain a critical tool to monitor the pandemic, particularly in times like right now when community testing is very low. Now, at the same time, we see promising trends across the United States. We're seeing concerning trends throughout much of Europe. The combination of the more transmissible BA.2 variant, as well as reduced mitigation measures and waning immunity, is leading to increases in COVID in nearly all of Western Europe. The UK, Germany, France, Italy, Portugal, Switzerland, and others. Now, meanwhile, our own levels of BA.2 here in Wisconsin also continue to increase. Most recently, we hit 27% of sequenced virus being BA.2 in Wisconsin. Now, on one hand, that's a level that's nearing that of the European countries where COVID is now on the rise. It seems that we're about 3 to 4 weeks behind the UK on BA.2's predominance. And the UK is currently seeing a rise in COVID cases and, more concerningly, in COVID hospitalizations as well. But on the other hand, we've seen that it's hard to use trends in other countries to predict what will happen here. We can be hopeful that our recent surge from Omicron may have provided a level of at least short-term immunity among our population that, coupled with vaccine-induced immunity, can blunt the impact of this variant. So in the coming weeks, we may well see an increase in cases, hopefully a relatively small one, or we may merely see a slowing in our downtrend of cases. But one way or another, looking to the future, this is not the last variant that we'll see. We don't know what the next iteration of COVID will look like, but what we do know is that the best way for us as a community to be future-proof in the face of new variants is to increase our vaccination and booster rates. And we continue to see low levels of vaccination across the county, but particularly among populations of color and younger populations. So we should take advantage of this moment of low disease burden to reach out to family, to friends, to neighbors who are not yet vaccinated, to share our experience and help them to become more knowledgeable and comfortable getting the vaccine and getting themselves protected. Thank you and stay safe, and I'll hand it to Dr. Gutzeit.
Thank you, Dr. Weston. Good afternoon, everybody. And as Dr. Weston stated, the local numbers are encouraging, but with a cautionary note. So we need to be vigilant. We need to continue to watch those numbers. And as Dr. Weston said, vaccines are one of the most important ways to prevent serious preventable illness. Things like measles, polio, COVID, influenza, all of those are preventable with safe and effective vaccines. And we want to continue to provide information for people from trusted resources to allow them to gain the information that they need to be able to make those decisions about being vaccinated. And I couldn't agree more. We're at a point where we have a bit of a pause, and there is a little bit of window here where we might be able to increase immunizations or vaccines to prevent the likelihood of outbreaks again. One of the things that we're watching at children's, to Dr. Weston's point about the lower numbers of vaccines in kids, is when vaccine will be released for COVID vaccine will be released for those less than 5 years of age. That's been a topic of discussion for months now. And the FDA continues to consider information and relevant data to make that best informed decision about when to release the vaccine for younger populations. So at Children's, we're watching that very, very closely. That will be yet another way to vaccinate the community and prevent the spread of COVID. I'd also like to state that at Children's, we have availability for both influenza as well as for COVID vaccine for the community. There's an available website that you can access, and we can certainly make arrangements for vaccines for kids if needed. So with that, Catherine, I'll turn it back over to you.
Excellent. Thank you, Dr. Gutzeit. We've got a few questions coming in here. The first being from Christina Van Zelst. For either or both of you. She's saying, with cases on the decrease, is it safe for people to gather in person now in large groups? And what about travel as well?
Yeah, so I can start here. So I think in a time like this where the disease burden is low, we can be a little more liberal with the sort of mitigation strategies that we're taking, but it still is important to think about layers of protection like we've talked about before. So think of the different layers. Think of vaccination. Are people in that group vaccinated? Think of masking. Think of distancing. Think of ventilation. If you don't have any of these layers in place, you may want to be pretty cautious with that event. But if it's an event where people are all vaccinated or largely vaccinated, if it's more spaced out, certainly those are events you can be much more comfortable participating in now than you might have a couple months ago when our case burden was much, much higher.
Excellent. I don't have any additional questions in the chat, so I will just give it one more minute to see if anyone else has questions for either of our guests today.
While we're waiting just a second, I'll just highlight the point that Catherine put in the chat, which is that when you're thinking of getting vaccinated, there's a new incentive opportunity out there. So the South Shore health departments, so that's Cudahy, Oak Creek, South Milwaukee, St. Francis, are giving $50 Visa gift cards to people who are getting any dose of the COVID vaccine. So if you didn't have enough reasons to get vaccinated, there's one more.
Yes, thank you for calling note to that, Dr. Weston. And seeing as we do not have any additional questions, I will conclude our briefing for today. Thank you, Dr. Weston. Thank you, Dr. Gutzeit, for joining us today. And we will see you again next week. Take care.
Thank you.
Thanks, everyone.